Welcome to our first webinar, in which we hope will be a series as you navigate through special education in South Carolina public schools during COVID-19. My name is Becky Davis, and I am the Director in the Office of Special Education Services at the South Carolina Department of Education, and I'm going to discuss the changes between a typical school year and this school year. Then Amanda Hess, an attorney with Disability Rights South Carolina, is going to discuss some common questions we have heard. Finally, we'll provide some resources at the end. Up until March 14, 2020, we were moving along through the spring as we had many springs before. Our priorities were ensuring a free appropriate public education, or FAPE, for our students with disabilities, setting up annual reviews, and communicating typical end-of-the-year information to parents. We were getting ready to administer the end-of-the-year standardized assessments and thinking about closing out the 2019-20 school year very similarly to the way we had closed out other school years. We were planning proms, graduation celebrations, and maybe even summer vacations. And then came COVID-19, and overnight everything changed. Our priorities shifted to health and safety needs for our students, staff, families, and communities. We found ourselves in emergency response mode, closing school and other public buildings, figuring out how to get meals to students and families, and focusing on student family needs to establish a different communication than our typical face-to-face interactions. School and district staff and families had to create, literally overnight, new ways for students to access some sort of continued educational opportunity. No one knew how long this would go on. Districts, schools, and families made reasonable and practicable attempts to continue some sort of continuing educational opportunity for students. Teachers were completely redesigning instructional delivery while constantly being thrown new rules. I heard it described like flying the plane as you build it, then strapping on a parachute, and then jumping onto a new aircraft in flight. And many teachers were doing this while parenting their own children and going through their own emotional turmoil. Teachers created packets, lessons, new ways to communicate and deliver instruction. Parents grappled with how to support their children with learning at home while ensuring they were safe physically and continuing to provide financially for their families. We waited for guidance. The states waited for guidance from the feds, the districts waited for guidance from the states, the schools waited for guidance from the districts, and families waited on guidance from the schools. Everyone kept looking for the instruction manual, the how-to book for how an educational system should respond during a pandemic. We kept postponing and rescheduling events, proms, ring ceremonies, graduations, thinking that surely we would wake up the next day and everything would be back to normal. That's a phrase we all heard and said again and again, back to normal. We kept waiting for normal to come back as we canceled proms, band concerts, graduation ceremonies. And we added new words and phrases to our vocabulary. Novel Corona-19, COVID, quarantine, social distancing, and hand washing, a skill we all evidently needed to learn and practice. So jump back in time to previous summers. We were wrapping up another school year, beginning to offer extended school year services to students, running the Summer's Read to Succeed camps for third graders, running summer school and other summer programs like marching band camps, taking family vacations, attending summer camps, and planning for the next school year. These were things we had done over and over. But the summer of 2020 was different. We were in quarantine. Churches, restaurants, movie theaters, and sports venues were closed. Travel was restricted or in some cases banned. We were required to wear masks in public, and we were still trying to figure out what happened during the spring. Our lives were still sort of on hold as we watched the numbers get higher and higher. Priorities continued to be centered on health and safety as we waited to get back to normal. We waited to see if we could hold any type of summer program, and if so, when. But we started mourning the loss of life as we knew it. We started grieving for normal life, and we waited. But we did continue to build our vocabulary. We added more new words or used words in everyday conversation in new ways. Masks, recovery, reopening, CARES funds, spread rate. And we kept focusing on numbers. Number of tests, number of cases, number of hospitalizations, and number of deaths. Think back again to what the opening, not the reopening, but the opening of school used to involve. Back to school activities, shopping, school supply lists, open houses, meet the teacher. Who did you get for homeroom? In 2020, instead, we were talking about reopening, not opening. We're talking about academic recovery and leap days. We are continuing to watch the numbers bounce all over the place. District and school staff began to develop reopening plans based on different scenarios: high spread rate, moderate spread rate, low spread rate. And we kept adding to our vocabulary. We added the words hybrid, virtual, and face-to-face to our everyday vocabularies. Beginning in March, groups met to identify concerns and brainstorm solutions. A stakeholder group of parent and student advocacy, district special education, university professors, special education technical assistance centers, and the OSES staff met weekly to develop guidance for districts, schools, and families. The Department of Education and the OSES posted resources on our websites. The OSES held weekly calls with district special education directors and bi-weekly calls with parent and student advocacy groups. We met with staff from other states and from the Office of Special Education Programs in D.C. to share resources and possible solutions. We worked with the 2 national technical assistance centers that had been tagged as leads during the pandemic. And here is what we've learned so far. The Individuals with Disabilities Education Act, or IDEA, was not written with even the remote possibility of a global pandemic in mind. There is no how-to manual. Families, teachers, and staff made heroic efforts. The types of instructional opportunities during the spring differed significantly across our state. Despite the efforts of all involved, many students, families, teachers, and staff suffered physically and emotionally. The pandemic showed a spotlight on the inequities of our educational system. The following statement is from the September 28, 2020 guidance from the U.S. Education Department's Office of Special Education Programs. State educational agencies and districts are facing new and unexpected challenges in providing meaningful instruction to children, including children with disabilities, for the 2020-21 school year. OSEP recognizes that the COVID-19 pandemic has impacted various parts of the nation in different ways. OSEP also recognizes that circumstances continue to rapidly change, and ultimately the health and safety of children, families, and the school community is most important. Decisions about the 2021 school year, including how and when educational and other services are provided, are being made by state and local officials, with continued academic growth and the safety of the local school community being of paramount significance. As public agencies and officials grapple with challenging decisions, administrators, educators, and parents may need to consider multiple options for delivering instruction, including special education and related services to children with disabilities. Those options could include remote distance instruction, in-person attendance, or a combination of both remote distance instruction and in-person attendance, a hybrid model. However, OSEP reminds state education agencies and districts that no matter what primary instructional delivery approach is chosen, state education agencies, districts, and individualized education program teams remain responsible for ensuring that a free, appropriate public education is provided to all children with disabilities. If state and local decisions require schools to limit or not provide in-person instruction due to health and safety concerns, state agencies, districts, and IEP teams are not relieved of their obligation to provide a FAPE to each child with a disability under the IDEA. The Office of Special Education Services at the Department of Education wants to assure you that our priorities continue to be the health and safety of all involved, student needs, and communication. No rights under the IDEA have been waived. Regardless of the instructional model chosen by you as parents or by the district, your child has the right to receive a free, appropriate public education. The OSES pledges our continued support to districts and families as we work together to navigate through this new now. Let's talk now about some of the most frequent questions that have come up.
Where can I find my school district's reopening plan? All school districts in South Carolina had to share their reopening plans with the South Carolina Department of Education for review and approval. If you are unsure of what your plan says, you can ask your school district for a copy. Approved plans are also posted online. There is a link on this slide to the South Carolina Department of Education's website called School District Reopening Plans. Keep in mind that school districts are making reopening and continuing educational delivery decisions based on factors specific to their district. There is going to be variability from district to district as they face the challenges of appropriately educating students while also addressing safety for students and staff. What steps can I take to make sure my child has an IEP in effect? To ensure that an appropriate IEP is in place for each child, the IEP team may need to convene a meeting to determine whether any revisions to the IEP are needed. We understand circumstances are always subject to change and recognize that ultimately the health and safety of children, families, and the school community is the most important. Districts must make every effort to continue to provide children with disabilities with the special education and related services appropriate to their needs. As conditions continue to change throughout the country, some of the special education and related services included in a child's IEP may need to be provided in a different manner. However, all children with disabilities must continue to receive FAPE and must have the chance to meet challenging objectives. Therefore, IEP teams should identify how the special education and related services included in a child's IEP will be provided and should consider a variety of instructional methods and settings. For example, IEP teams can discuss how a child's IEP will be implemented with traditional in-person instruction and how services also could be provided through remote and/or distance instruction if circumstances require a change to distance learning or a hybrid model. In making these determinations, IEP teams should consider alternate available instructional methodologies or delivery, such as online instruction, teleconference, direct instruction via telephone or video conferencing, or consultative services to the parent, if feasible. What should I do if I have concerns about virtual education and how my child will receive services? Virtual service delivery has raised many questions for parents and students. Some students are flourishing in virtual, some are struggling. Some students' IEPs can be implemented in a virtual service delivery. In these instances, there will not need to be an IEP team meeting to review services in a virtual setting. Some students' IEPs will need to be reviewed to address virtual service delivery. If you are concerned that your child will not be successful in virtual education, or if your child has had trouble with virtual education, you can raise these concerns to the special education department in your child's school district. Parents can also request IEP meetings. You can request a special review IEP meeting to share and discuss your virtual concerns. Some services in your child's IEP may need to be updated for virtual education. For instance, if your child had direct occupational and/or physical therapy services, the team can review those services and how they will be provided virtually. The IEP team can also address if your child needs different accommodations to address virtual education. For instance, a student may need more breaks or a time in a breakout room with a school aide. COVID-19 has resulted in school districts expanding services and delivery formats to include different methods of virtual services and different ways of providing services. Service delivery exploration may also require the IEP team to think outside the box to determine service delivery. Keep in mind, IEPs are fluid documents based on the student's needs. If something isn't working, you can reach out to your special education department to share your concerns, and/or the IEP team can meet again to discuss. Despite alternative delivery formats for virtual services, some students may still need services in person to receive a free appropriate public education, also known as FAPE. In this instance, the IEP team should review this in addition to any health and/or safety concerns. What should I do if I am concerned my child is not making progress? Your child's IEP should state how often you will receive progress reports. Progress reports provide information on how your child is progressing in his or her IEP goals. If you are concerned that your child isn't making progress or regressing, contact your special education department to discuss your concerns. Parents can also request an IEP meeting to discuss concerns. What are some helpful tips you can share? This is novel for everyone, so know you are not alone. Here are some general tips. Maintain good communication with your school district. Good communication is especially important during this time. Parent and student input is important in the special education process. Share your thoughts on services, service delivery, things that may or may not work. If you have questions or concerns about your child's special education services, then make sure you let your special education teacher or contact know about them. Districts cannot address what they don't know. Maintain documentation of your questions, concerns, and how your child is doing. If you are experiencing problems that aren't getting addressed, contact your special education director or special education department to address them. Parents can request an IEP meeting to discuss special education services. In some school districts, this is called a special review meeting. COVID-19 has resulted in looking at educational service delivery in different ways. Don't be afraid to suggest and to try things that are creative or unconventional for your child to receive a free appropriate public education, also known as FAPE. Be aware of resources. You will find some on the next few slides.
We know that navigating through this is hard. We also know that there is a great deal of information out there. We wanted to leave you today with 3 websites where you can find information about social and emotional support and hybrid and virtual support. In future presentations, we'll be sharing additional resources. We also wanted to let you know that there are real people out there to help, not just websites. All of the agencies working to put these videos together have staff who are ready, willing, and able to help you navigate through this. Please don't hesitate to reach out to any or all. Disability Rights South Carolina, Family Connections of South Carolina, ABLE South Carolina, or the Office of Special Education Services. The following slides contain a brief description of each agency.
Disability Rights South Carolina, also known as DRSC, works to protect and advance the legal, civil, and human rights of people with disabilities in South Carolina. Founded in 1977, it is the federally authorized and funded organization serving as the protection and advocacy system, the P&A, for South Carolina. DRSC is a private, nonprofit corporation providing free services statewide. Learn more about us on our website at www.disabilityrightssc.org. Family Connection, South Carolina. Families with shared experiences are uniquely qualified to help each other, offering support, guidance, and encouragement. Because of this, all of their programs and services are family-centered and based on the concept of parent-to-parent support. Whether you're just beginning your journey or have a question along the way, they offer a variety of services and resources in the areas of families, healthcare, education, training, and advocacy. ABLE, South Carolina. ABLE SC is a Center for Independent Living, a CIL, an organization not about helping people with disabilities, but built on the central concept of self-empowerment. It is a consumer-controlled, community-based, cross-disability nonprofit that provides an array of independent living services. They do everything it takes to empower people with disabilities to live active, self-determined lives, including advocacy, services, and support. More than half of their staff are persons with disabilities, as are over half of their board of directors.
The Office of Special Education Services at the South Carolina Department of Education has a position dedicated to helping families resolve issues and questions related to their child's special education services. The Ombudsman position is designed as a resource where parents can call to ask questions regarding the laws and regulations pertaining to students with disabilities and regarding specific concerns about the IEP process. The Ombudsman also assists in resolving informal complaints by acting as an intermediary between parents or guardians and the district administrators. Thank you, and we look forward to working with you, our families, now and always, to ensure all of our students have equitable access to meet the profile of the South Carolina High School graduate. Please look for additional videos in the series coming soon.
This statement only pertains to the work on this presentation by Disability Rights South Carolina, also known as DRSC. This presentation provides general information not intended to be legal advice. The views expressed by DRSC in this presentation are solely those of DRSC. This document is partially funded through a Social Security grant. Although Social Security reviewed this document for accuracy, it does not constitute an official Social Security communication. This communication is printed, published, or produced and disseminated at U.S. taxpayer expense.